Well, good evening. We're out and about tonight. We had a wonderful dinner at Luciano's again.
Yeah.
Yep, wonderful dinner at Luciano's, and then we went and started looking at some real estate. And so we are out and about. And tonight we are going to talk about the archetype of the patient that we see the most, that we have the most success with, and that patient is the chronic pain patient. And actually, Jess, I'll let you kind of describe how they present.
So, so on the functional medicine side, which is what we're talking about, chronic pain, it's usually related to joint pain. Like we hear a lot about feet pain, leg joint pain, knees, just overall joints, and
Back,
typically
low back.
low back. And typically, that is usually related a lot of the times to hormones.
So, laboratory wise, when we look at these people, like she said, we see number one that they are typically stressed, and we see the cortisol curve actually kind of flat and low. So, their cortisol is low and their DHEAS is low. So, if those two things are low, then the patient cannot actually produce their sex hormones. And if you can't produce your sex hormones, well, what's going to be affected? Big time testosterone and estrogen, as well as all of the others. I mean, you can't, what, negate, ignore the other hormones, but the big ones are testosterone and estrogen. And as we get people on supplements with
Well, and if you can't produce those hormones, you're not also producing other hormones like your thyroid, your there's all
it's all
different kinds of
intertwined.
hormones. So it's we talk a lot about testosterone and estrogen, but if your body's not producing those, they're not producing a lot of other ones.
Yes. And so the other thing to watch for, and we usually go after the hormones first, because if we see those being a problem and we can get you either supplemented or pelleted with bioidenticals, then all of a sudden life is much easier. But then what we see is the microbiome is off, and people will not be able or won't have the microbiome that will produce the short chain fatty acids. And if you're not producing your short chain fatty acids, then you don't have the ability to produce the eicosanoids. And I'm using a lot of big words, doctor words. Basically, you can't produce the anti inflammatory um, components of your body that will allow you to turn off the immune system. And that's the other thing is what is your immune system doing? So we can start to see with the organic acids, are the mitochondria producing enough energy? If they're not, then we know that we need to get in there and start to address these things. And it's not easy. And so, like last week, we were talking about the patient that is tired, who basically is overworked and stressed and is tired. And this week, we're talking about the, oh my God, my shoulder hurts, and now my hip hurts, and now my knee hurts, and this elbow hurts. They're also known as fibromyalgia patients, chronic pain patients, chronic fatigue patients. These are all kind of synonymous,
Well, there's a new diagnosis, the pain syndrome. Oh, what's the new one? Everybody's getting
like
labeled.
SIRS.
Yeah.
Okay.
Well, not SIRS. It's a pain syndrome. It's a new diagnosis. It's kind of like fibromyalgia, but basically you just can't turn the pain
The-
pain off, and it's usually related to a surgery of some sort.
And so that's where we come in and help people really look at what actually modulates the immune system and what helps to start people feeling better. Go ahead.
Well, and so it's a perpetuating cycle. You have to be able to turn it off or it just continues on with itself.
And those things are people, I'm telling you, and I know I am beating a dead horse here, but fiber feeds the microbiome. The microbiome feeds the system for the short chain fatty acids and stuff. If you are not getting 25 to 30 grams of fiber a day, your immune system's not going to work, your hormones are not going to work, your your neurotransmitters aren't going to work. So you can't ever just take one component. You have to look at the entire system. And then you have to start to prioritize what needs to be addressed. Because if you have chronic pain now, and let's say you're 50 years old, well, life expectancy is into the 80s. So you've got another 30 years of pain. And what do you think is going to happen? Do you think it's just miraculously going to go away if you keep doing what you're doing? That's kind of the definition of insanity. Keep doing what you're doing, you're going to keep getting what you got. And don't depend on, I'm not bad mouthing medicine, but I will say that they miss the boat on this. They don't look at the organic acids, they don't look at the omega 3 index, they don't take a deep
Well,
look at
Not all, most.
majority. They, Dr. Windley does a good job. I'm not going to discount the work that he does, but pretty much your other doctors, mm, it- it's not that they're bad, they're just not trained that way. And that's what we do. So if you have chronic pain, if you have joint pain that moves around, if you have pain that doesn't go away, if you have treated it with the anti-inflammatories and all that jazz, and now you start to have other issues like skin issues and things like that that are starting to show that your gut's becoming disrupted, you really got to change course before you get into serious, serious trouble. Anything else to add, babe?
No.
This one's kind of short and sweet. It builds off of last week because, like I said, you can't look at just one aspect because the human body is a network of systems and they all work together so that you feel good, so that you can do what you want to do and you can be with family members and you can be with your kids and grandkids and you can do the things that you want to do. And that's what we're all about. We're all about getting you to feel the best that you can feel so you can play with your kids, grandkids, nephews, nieces, go hunting, do what you want to do.
Adventure.
Absolutely. With that being said, y'all have a great well, we were trying to do the sign off and I dropped the phone. So that got all befuddled. So, with that being said, have a good evening. We hope you're living your best life. And if you're not, we're here to help you and help you heal from the inside out so it's sustainable. Have a great evening.